We need medical technology in the practice of medicine. I can remember back in the 60s and 70s when there wasn't all the technology we have today, and how much more work it was to be a clinician, a real clinician who worked more with the biochemistry of what's happening in the body, and by using our hands and our eyes and ears to notice what was happening. And the breakthroughs have been tremendous. We're looking at things like MRIs and CT scans and incredible tests that are using nuclear isotopes to tell how hearts and other parts of our body are functioning. But they always come at a price, and usually we don't find out what that price is until we find out what the problem is. And when it comes to dental x-rays, everybody's always thought, there's so little x-ray involved in that, and now we're using digital film, so why are we worrying? And now a study comes out in the journal Cancer in April of 2012 showing that frequent dental x-rays increase the risk for meningioma. My gosh, a brain tumor. They looked at 1,400 people who had and didn't have dental x-rays, and then they, on an annual basis, and noticed that those that did have the dental films in a routine sort of way yearly, that the risk was 1.5 to 2.0 times what people who didn't have the x-ray would get for meningioma. And those that had the panorex exams every year, there was a 3 times increase in risk for meningioma. For kids under the age of 10, the risk was 5 times higher. What have we gotten ourselves into? And the American Dental Association is kind of poo-pooing this. Maybe much like it does when it comes to mercury. You know, those amalgam fillings that we put in our mouth, and we look at mercury toxicity. Oh, they work well, don't worry about it, is usually the answer. Now, how much of that is related to income? You know, somebody comes in, you do the dental films as a routine basis, you're going to make a sizable amount of money by the time the day is ended just from doing x-rays. And how much of it is because they want to practice defensively, meaning they don't want to get sued if they do something that turns out to be a problem that maybe could have been found if they'd done a film. The problem of overdoing things in diagnostics and medicine is now coming into the limelight, and we're finding out things like EKGs and chest x-rays are not routine tests that should be done. Things like carotid ultrasounds and specialized tests like echocardiograms, maybe even doing special tests that are screens for cancer, are way overdone. And now we go to look at a simple little thing like a digital x-ray that's taken by a dentist, and here we have an associated problem. That should open our eyes that there's a real issue here that needs to be dealt with. We can't be so cavalier that we just go ahead and do these things without doing the studies that go with it. Look at the studies of the Professor John Goffram from the University of California in Berkeley, who's now retired. But he did work that associated breast cancer and heart attacks with where radiology facilities were located. Now, it doesn't mean that it causes it, but it's very interesting association. Simple little things like being around X-ray in low dose is both good and bad for us, depending on which studies you read and how detailed you get when it comes to looking at some of the findings that are being associated. So when we do a simple little thing like a dental x-ray that's a digital film, we should think twice. When we do anything on a routine that's doing something to our body and we don't really know all the biochemistry and biophysics that's involved, we should be cautious, because if not, things like this will happen, and the next thing you know is we'll have other problems that are associated that can be very serious.